All right, as we're bringing November to a close, we just want to take some time to highlight diabetes awareness. Of course, a lot of people have a general idea of what diabetes is. What's really scary is that a lot of people are not even aware that they have diabetes, and that's just part of the problem. Joining me right now in Studio 61 to dive more deeply into the ins and the outs of this chronic disease, happy to have Leila Bruno, the diabetes coordinator for diabetes education coordinator for sorry, I want to say Trinity Health of New England. At St. Francis Hospital, but of course you work with Trinity Health of New England.
Absolutely.
All about a pleasure to meet you.
Thank you so much for having me
Glad to
today.
have you here.
Thank you.
I know we were just talking about the numbers that between people who are diabetic and pre-diabetic, it could be about half the country.
Right.
You had a very alarming, to me, number about how many people are not even aware that they have diabetes.
Right now we have 38 million Americans with diabetes in the United States, and 8.7 million of those people have no idea that they have diabetes.
Right.
What's worse is 97 million people have prediabetes, which has no symptoms, and left unchecked, that will become diabetes. We have our work cut out for us.
We certainly do. All right, first things first, we need to get people aware that they might be on sort of that road down to being diabetic. What are the symptoms that people should be looking for?
So there may not be any symptoms in the earlier stages of diabetes where blood sugars are just a little bit abnormal, but as the blood sugars climb, there can be significant symptoms, including increased thirst, increased urination, poor concentration, fatigue, sometimes weight loss because the body can't use the nutrition that person is consuming.
Right.
So those are kind of the end stage symptoms that say, hey, there's really something going on here.
Okay, well, that is good. That's what people, it worries me, like you were telling me before, that some people, there's just not always symptoms to start.
There aren't sometimes, right.
So I imagine that makes screening a lot more important?
Absolutely. So because of that, certain risk factors put people higher at risk for developing diabetes. And so if you're overweight, if you have a family history of diabetes, if you're a woman who had a history of gestational diabetes, which is the kind that you can have in pregnancy, those increase your risk for developing diabetes later in life. Diabetes can hit at any age. It doesn't matter how old or young you are, so we don't want to use age as a criteria. We want to think about family health, family history, or if you're just not feeling right, everyone should get checked for diabetes at least once a year, especially if you have some of those risk factors. Now we're also talking about COVID being a risk factor. If you've had the COVID infection, that potentially could trigger the development of diabetes. So we don't want to waste any time. If you're concerned, you want to see your doctor and have a simple blood test to find out where your blood sugars are hanging out right now and what we need to do to move the needle towards a healthier place.
And at the Education Center, what else are you trying to teach people that you want everybody out there to know?
Thanks for asking. So at St. Francis Hospital, we have a great diabetes education program where we receive referrals from primary care providers as well as endocrinologists. And this is a benefit that's covered by most insurance plans, at least at 80%, including Medicare. So we want people to ask their doctors for a referral for diabetes education so they can learn the ins and outs of managing diabetes beyond just taking your medication. There's so much more we can do with nutrition management, exercise, weight management, stress management, working on sleep habits. That actually makes a huge difference in terms of controlling diabetes.
Yeah, you mentioned management, and I feel like that's almost underselling it, giving what a huge difference, especially diet and exercise, can make with type 2 diabetes.
Absolutely. Nutrition really does have a significant impact on glucose values, no matter what kind of diabetes you have. And it doesn't mean cutting out your favorite foods. It does mean learning how to portion control, how to balance your nutrition. So kind of the age-old advice of balance your plate with your vegetables, your protein, your carbohydrates. We want carbohydrates. You don't have to stop eating them, but we don't want to go crazy. We want to be aware of how much is impacting our glucose and what we can do to keep our glucose in a target range.
And that's why education could make such a big, big difference. Leila, thank you so much for taking the time.
Thanks so much for having me today.
Yeah, a pleasure to have you.